Okay, we're going to go ahead and get started. Hello, everyone. I'm Rose Gerber, the Director of Patient Advocacy and Education for the Community Oncology Alliance. May is National Oncology Nursing Month, which is a wonderful opportunity for us to shine the light on another very valuable and important member of the cancer care team in an independent community oncology practice. Our special guest today is Shannon Besselman, a clinical manager from Northwest Medical Specialties in Washington State. And as I mentioned, May being National Oncology Nurses Month, every year they have a theme, and their theme this year is Caring Beyond Limits. And I thought that was such a wonderful description for the experience that so many of us as patients and cancer survivors have had with nurses. But oftentimes we only know about maybe one role, see an oncology nurse in one role. And it's going to be very educational today to hear from Shannon about the variety of roles that oncology nurses play. So it's my pleasure to welcome you, Shannon.
Yes, thank you so much, Rose. I just want to start off and say, good morning, good afternoon, wherever you guys are tuning in from. And thank you so much for this opportunity to talk. Next slide. All right. So as Rose mentioned, my name is Shannon Besselman. I am one of the clinical managers at Northwest Medical Specialties based in Washington State. We are a hematology oncology practices. We have 6 locations. We are in Puyallup, Tacoma, Bonnie Lake, Federal Way, and Gig Harbor. So we've got 6 locations with 13 MDs and 20 APPs. We only have infusion in 5 of our locations. So we have 25 infusion nurses. And I'll get into their roles a little bit more here shortly. Our triage nurses, we have 10 with RNs and LPNs, and they are our remote nursing. And they take our calls from patients who have, having some symptoms, whether they need to be seen in the office for any acute needs, or helping them, work through some of the symptoms that they're having due to their treatments. So we can help guide them in, taking some of the medications over the counter or that have been prescribed by the provider to kind of combat some of those symptoms that they might have. And we have research nurses. We have 9 of those. When people think of research nurses, I think they commonly think of clinical trials. Our research nurses go way above just clinical trials. They coordinate with the providers to see if there's any new indications that patients might be able to do. They go through the charts, comb those charts, and their scans and everything to see if there's anything that might be eligible for them. We also have a theranostic nurse, which is very unique. She is actually a nuclear medicine RN, and she delivers all of our theranostic drugs. And we only have that in one of our locations, which is our Puyallup location.
Shannon, a couple of questions on this slide. So
Yeah.
triage nurses, out of curiosity, were they working remote before COVID, or was that something after COVID, or is that how it's been standard?
So we do actually no, great question. We started out, they were in person. And then gradually as our practice grew and life prior to COVID though, we did go remotely. I have triage nurses in several different states actually. I have one in Arizona, one in South Carolina, and one in Georgia, and one in Texas. So they're kind of everywhere, and they're doing an amazing job.
Right, really expands your reach, I would imagine. And so the
Yeah.
theranostic nurse, and I had said this to you when I first got your slide.
Yeah.
Can you repeat that role again? Because it is very different. And I'm curious also, I don't know if you know the answer to this, but is that something that a lot of community oncology practices have? Or if you could just explain that a little bit more, please.
Yeah, it's definitely growing, that's for sure. We've been working for several years now to just kind of, boom that up a little bit. But our main theranostics nurse, like I said, she's a nuclear medicine tech and an RN, so that's super exciting. And she, monitors the patients that are on theranostics because that's so unique, that we don't have a lot of, most of your infusion nurses don't have a lot of education on those drugs that are being infused in that location.
And I would just one more comment on this slide.
Of
Also, I really,
course.
because I just learned something too about the research nurses. We do think about clinical trials. And one thing that you mentioned that was so important is that they're being very proactive, looking for a lot of new information.
Absolutely.
And that's one of the unfortunate incorrect criticisms of community oncology that I've heard, when I've been in various oncology settings or at conferences with other advocacy disease groups, where they'll think that the community oncologists or the nurses aren't being proactive. And you just clearly demonstrated that they're very proactive. So thank
Yes, yes. Yeah, sometimes they find it before the providers too. The the our coordinators in research are constantly going through the patient panels of all of the providers and looking to see if there's just anything new that might make these patients eligible for something, a new trial that's come that could potentially save their life.
Wow, that's wonderful. Thank you.
Yeah, absolutely. And just a reminder to any of you out there, please feel free to type in the chat, or there'll be a later slide with with all of my contact information if you'd like to reach out to me directly. Okay, next slide, please. All right. So as Rose mentioned, I am currently a clinical manager at Northwest Medical Specialties. I started off my nursing journey as a bedside nurse in a hospital. And I can't imagine anything better in my nursing career to start with. I saw patients, coming in from the beginning and until discharge. And it was definitely a very educational experience for me. I moved out of that setting when I moved to Washington State. A little bit background on me: my husband was military, so we left Georgia and moved up to Washington for his job. And I spent a year at the hospital there and met some of the providers at Northwest at that location, at that hospital, and just fell in love with their passion for what they did. And so I joined that team. I started off as an infusion nurse at that Puyallup location, and gradually just moved up into supervisor and now more senior leadership as a clinical manager. I currently manage our back office MAs, our infusion nurses in our Puyallup location, our triage nurses, as well as our treatment schedulers and scribes. So quite a bit under my belt, but I've got a great team, and I've got even better senior leadership and above me that are very supportive. So great teamwork at that.
Thank you. I'm sorry that. So the
No,
scribe,
of course.
again, a lot of practices, are many practices still using scribes? That's interesting. I haven't heard that in a while.
Yeah, I was actually just at our OnCare summit, and several of the providers there had talked about how they are using scribes, whether it be live dictation while they're in the room, and a lot of technology is always changing, but there's a lot of AI things happening too.
Yes,
So we
absolutely.
currently have in clinic scribes, as well as we use another outside entity that does scribing. It's not necessarily, it's more of the prepping of the note for the patient, for the providers in that scenario. But we do have two in-person scribes that sit with the providers while they're with the patients and dictate those notes for them. So it's super helpful, and just kind of gets that, in the moment, where the doctors don't have to stop focusing on the patient in that moment and worry about what's going to be missing in that note later. So very helpful.
That might
Yeah.
be a chat for me too. The scribe role is very interesting, very valuable too, right? Thank you, Shannon.
Yeah, no, absolutely. Thank you. Great question. Next slide, please. All right. So I chose this to kind of focus on the infusion nursing role. Like I said, there's so many amazing nursing opportunities, not just in oncology, but everywhere. But with our practice, like I mentioned before, we've got triage and research and our theranostic nurses. But I chose to kind of focus more on the role of our infusion nurses. They are really the people that have the ear of the patients majority of the time. You see, as an infusion nurse, you'll see these patients, sometimes every other day, depending on, what their cancer journey is bringing them, whether it be they're coming in for symptom management, antiemetics and fluids and things like that, or, it is their treatment. So they see these patients, sometimes every other day, sometimes once a week, sometimes every 3 weeks, depending on their treatment plan. So they really get to know these patients. And with that, they provide so much education as far as the medications that they will be receiving, as well as side effect management for when they get home. Um, Cancer is a crazy thing, and we do so much to try to save these patients, or at least prolong their life. And with these medications come so many different side effects. So making sure that they're able to manage those at home and still be able to maintain some sort of quality of life, and they're being able to go to, whether it be their children's or grandchildren's sporting events, or things like that, is really important. And the infusion nurse really gets to have that contact with patient and reinforce some of that education that they did receive in the beginning. They also help provide psychosocial support, which is so important in that journey. We do have social workers that, can meet with patients when needed. But like I said, these infusion nurses see these patients so frequently, and they become almost, a friend. These patients can actually feel confident talking to them, and maybe they're there for an extended period of time, not those quick visits with the providers sometimes, where you almost get caught in like deer in the headlight. I remember going through my own personal cancer journey, um going into those visits with the provider, and I have my notebook and I wrote everything down, all my questions, but you get there and you're like, what am I going to talk about? You're listening to what they have to say about your labs and all of those things. But then you go to the infusion appointment that could be an hour, several hours long, depending on, what you've got going. And you just have that more time. And again, you've created that bond with that infusion nurse, or the other support staff in the infusion room. So not only with the patient are they creating that bond, but their family members. So in our practice currently, because of COVID, we do only allow one other person back in the infusion rooms, and they have that family member, or friend, whoever it may be, that does come back with that patient, is also going through a lot. They're that support person for that patient. So having that opportunity to speak to the infusion nurse, and be there for their loved one, or friend, or whatever, is very important. And so they can get that one-on-one time and hear what the infusion nurse is saying to them, so they can help support them when they get home as well. Another very important role of the infusion nurse is providing proper dosing and making sure the safety protocols are in place. Well, patients going through this journey may lose weight or gain weight, and we need to make sure that all of that's been notated, so that they're getting the proper dose of that drug. Making sure the safety protocols are in place, whether it be making sure they had that echo done because they're receiving, Herceptin or adriamycin, or making sure that they had that audiology appointment. So just making sure all those T's are crossed and I's are dotted. During their infusions and treatments, they make sure that their vital signs are within limits. And then if not, they can discuss that with the provider, the care team. They review the labs. They review any of the radiology that comes back, just to make sure that that's still the plan. They work really closely with not only the providers and the on that team, but as well as other members of the team, as far as it being pharmacists, to ensure that they have the oral drug that they need to be taking, or that the you know anything that needed to be changed as far as dosing is changed. They work with the social workers to ensure that, if this patient does need a little bit more TLC or has questions in regards to, anything as far as, um, oh, sorry, just drew a blank.
Just
I'm
any
sorry.
additional. So
Yeah,
Shannon,
absolutely.
on the social workers too, I would like to explore that a little bit more because I so the social workers, which are incredible. I've also had oncology
Absolutely.
social workers as guests, and I actually went to an oncology social worker myself during my own treatment. So there's no like rivalry, right,
Well,
between
no.
your plane, or no one ever feels that they're overstepping. What do the patients ask you, like, if they need, do they just start opening up because of the trust and the bond that they have with you? And when do you know that it might be time? Like you mentioned, okay, they might need a little bit more. Is that going to be based on the individual patient, or do you have like formal guidelines when, okay, at this point we need to go get them over to a social worker? How does that play out?
Yeah, no, absolutely no rivalry. We're all one team and we're all there for the patient. So, but yeah, great thoughts though. But yeah, no, we're all one team. And so I think, they give us a lot. We do have guidelines, but a lot of it is, the patient does again open up to that infusion nurse, or other support staff, and they kind of will tell you a little bit more than what they get to say in those office visits. And then at that point, we can just put in a referral to social work.
And I like also how you mentioned that you're interacting with the patients, but you're also interacting with the caregivers, which
Yeah.
is so important. And we just had our, the COA, big COA conference, and we talked about the role of the caregivers in the advocacy session. Are you finding that the caregivers might ask you some questions or look for more guidance than maybe the patient might be asking for?
Yeah, no, definitely, absolutely. And again, that is a fine line with HIPAA and things. So, definitely got to be, vigilant and make sure you are able to speak to those support person. But yeah, I definitely think that they do. I think, again, like you mentioned, I think a lot of times when it's you sitting in that chair receiving the treatment, it kind of goes out the window, the questions that you had. So that it's so important to have that support person, because they're like, well, Rose, remember you wanted to talk to them about the nausea you're having, things like that. So I definitely think that it's super important. Yeah.
Shannon, you opened up by talking about your first role in nursing, being in a hospital setting, and
Yeah.
coming to the parent that you're now a survivor.
Yes.
That, or has it changed your, I'm sure you were always a very compassionate nurse, but has it changed how you perceive that patient nurse relationship? And if so, how?
Yes, yes, yes. No, absolutely. Like I said, it's completely different when you're on the other side of that chair. I think that, as an infusion nurse, um, obviously compassion is number one in nursing, but you're kind of just going through the motions of the day, and you're having those conversations with the patients and trying to get them in the, direction that they need to go. Um, and completely, finishing off your treatments and things like that. But now, I have just a different perspective. It's like, okay, so with this treatment you might find, where before, as the infusion nurse, it was almost routine. Like, I saw that their treatment plan was this, and then you can have those conversations like, okay, so typically on this type of treatment, blah blah blah. But now, as a survivor, I just have a different perspective. Like I said, sitting on in that chair, of things that you don't realize that you need to ask until you've been in that seat.
Mm.
um so yeah, it definitely has brought a different perspective for sure.
Yeah, thank you for sharing that, Shannon.
Yeah, no, absolutely, absolutely. It's a crazy ride for sure, but it definitely has brought a lot of, I've brought a lot of things back from it,
So
to
it's your own,
to our practice.
right? It's your own form of education. I'm looking at your first,
Yeah.
providing patient education. When the patients come into the practice, are they getting, because I know that every community oncology practice might do things a little bit differently. Is
Mhm.
that a meeting where you have the patient in the room, the first meeting, here's what to expect with the upcoming treatment. Do they go home with an old school folder?
Yeah.
Using what kind of technology are you using? And then how do you keep them educated throughout the process? And then when you jump ahead to the survivorship stage,
Yeah. So once they have their initial, once the patient has their initial visit with the provider and a treatment plan has been established, we do have them scheduled with an APP to provide that, more formal education training on the drugs that they're going to be receiving during that treatment. They go over side effect management and things like that. Um, During that training. Like I said, I have done this for a living, and even in my own personal education that I had when I started my journey, I was like, they throw a lot of information at you, right? So
right.
that's again why it's so important for the infusion nurse, because they re-educate, reinforce things during that first treatment and ongoing, because it's cumulative, so things happen later down. So yeah, it's they definitely get a formal education, but like I said, that's why the reinforcement is so important, and that's part of what the infusion nurse does.
Right, and that continuity of care that you talked about earlier, the patient
Yes.
coming in more frequently, they trust you, and so yes, they have that formal education, but they're probably just learning a lot just through some informal back and forth conversation. And the nurses pick.
Yes.
You can't hide anything from a nurse. I've discovered you can hide it from your you can tell your oncologist, oh no, I'm feeling fine, and I remember my nurse saying to me, Rose, I know you're not. I can tell you something, but I was like, oh okay. um, Well, this has been really good information, Shannon. Does anyone
Yeah.
have any questions, or Shannon, is there anything else that you would like to share about your role in nursing, or for anyone, even like, young nursing students, established nurses, anything that you want to share?
Um, no, just you're always learning, and make sure that you always continue to learn. That's one thing that I found. As soon as you think you know it all, there's something new that comes. So don't ever get too cocky. There's always
Yeah,
more to learn.
melody. I literally just said that in a storytelling presentation at the COA conference because we can all learn so much from someone else. I have a very like learning mindset, so I think we all should, right? Just keep learning.
Yeah.
There's new things to learn. Even if you're excellent at something, there's something new to learn, but you do have to have some humility. Even
Yes. No, absolutely.
and a professor, as I like to say. So even though I've been hosting these chats since 2020, and I think I know quite a bit about oncology and policy and advocacy, I learn something new every time. And when you sent me
Mhm.
your slides, I didn't know about the nuclear nursing. That I knew about a little bit, but I learned some more. So thank you for being our professor and also
Yeah.
a survivor. I mean, I know you have one
Thank
more
you.
slide. Did you want to go to the next slide, Drew?
Yes, please. Uh-huh. So I just want to, say thank you so much again for allowing me this opportunity. My name and contact information is here if anybody has any questions, and you can contact me directly. The slides will be available on YouTube as well as the COA Facebook page. And I'll turn it back over to you, Rose.
Thank you. Next slide,
Thank you.
please. I appreciate your insight, Shannon, again. And I think that your practice is wonderful. Abra, Dr. Blau, everybody there. So thank you so much. Okay, yes, we're going back to Capitol Hill again. It's official, June 11th. We still have some hotel rooms available. And if you were a patient or survivor treating a community oncology practice, please reach out as soon as possible to my assistant, Tracy Banks, and we can get your questions answered and send you a registration link. Again, we do have scholarships available for patients and survivors that we're treating a community oncology practice. And this is a wonderful group of our advocates from last year's Hill Day. And look at how happy everybody is. So you can be part of this happy place, but you got to act quickly. Next slide, please. Okay, and reminder, ways to stay engaged. Continue participating in our chats. We like knowing that you're there, you participate, and go watch this. Any of our advocacy chats that you might have missed are available, as you can see again on the social media channels. Sign up for our newsletter, the CPAN newsletter, which is now quarterly. Visit our website to learn more. Share your story on our website, and again, follow us on social media. Next slide, please. And next month, our very special guest is someone who's very, very well known in the national oncology space, and that's Sally Funasso, the Chief Executive Officer from the National Coalition for Cancer Survivorship, which I think is a phenomenal organization. Every year they do a national survivorship survey, which they did earlier this year. Shelley and I will be talking about that and a lot more news coming out from NCCS. So again, thank you all of you for being here today, and enjoy the rest of your day and the rest of your week. Thank you again, Shannon. Bye, everyone. Thank you.